This week on Delicious Ambitious, we meet Alison Rose, a sports physiotherapist specialising in treating athletes and sporting injuries. She's worked with the Great British Olympic team and regularly travels the world to various athletic events. She also worked with Kelly Holmes in the 2-year lead up to the Athens Olympics, where Kelly won 2 gold medals. We started by asking Alison to tell us a bit more about sports physio.
Sure. A few things that we do. Generally, obviously you get people in, they'll come in with an injury, and with sports obviously you need to get them back to competition and training as soon as possible. So we obviously identify the injury, work out where it's coming from, why they've got it. We treat the injury, we treat the other things around it, we give them stretches and strengthening to obviously help it get away as soon as possible. We advise on cross-training that they can do in ways that they can keep fit while they're off with their injury. We also do sort of pre-season screening, where again you look at people to decide whether they've got predisposing factors and reasons that they might get injury, whether it's postural or biomechanical or weakness or flexibility issues. And then we also sort of do performance enhancing kind of work where you'll help people with exercises and progress exercises to help them get stronger or more stable or more powerful, which actually obviously will then help them to compete better and run quicker and perform to the best of their abilities.
So how did you get into this whole field?
Yeah, originally I wanted to do medicine, so I got into another course because I didn't get the grades to do medicine first off, and when I got into the second year of that degree I actually realised that I wasn't really that into sick people, and so I decided that actually what I did really like was the physiology, the sports physiology, biomechanics, and at that stage I was running myself, so it was that kind of interest that led me to realise that I probably would make a better physio than I would doctor, hence the reason I changed course and went on to do the physio.
So once you decided you wanted to be a physio, what's involved in becoming one?
I did a 3-year degree course up in Edinburgh, and they do now sort of 2-year postgrad courses if you've got a degree in a related subject. Yeah, it's 3 years, and then you obviously carry on, and then you learn the basics at physio school, and then you have to go on and do all your courses that are related to the way you want to specialise.
Okay. What does a typical day look like for you?
If I'm at work in Leeds, it's a lot easier. Obviously, I've just got people coming into the clinic and we can get them out onto the track and we get them working, or on the tennis courts or whatever sport they happen to be in. If I'm away at a championships, it's obviously an awful lot busier. Usually we get there a couple of days early, or we can get there a week early if we have a holding camp, in which case we try and get people as straight as possible and ready to race well before we start. If you're going down to the track on competition day, you're usually up and in breakfast by 7 o'clock, leaving to go to the track by at least 9, and then quite often you can be really quiet down there and you just wait for people to come back, and it's post-event massage and just a little bit of stretching, and then other times it's a bit more sort of touch and go. You've got somebody who might have a niggle and you have to really try and get them to the best possible shape for that race, and then they'll come back and you do the post-race recovery, and then you need to get them ready for the next round. So that you're really just trying to get, particularly with sprinters when they've got several rounds in 2 days, they might have up to 4 rounds in 2 days, so you're having to make sure that they're in the best condition they can be in and don't put themselves at risk. And sometimes you're literally patching people up and sending them back out and just hoping that they come back in the shape that they left in, so it can be a bit nerve-wracking at times.
So how do you keep up to date with all the advances in sort of sports medicine and science and things?
Courses, conferences, talking to other people. I usually do a minimum of 2 or 3 courses a year just to keep up to date with things. And so, we've got a really good network of physios and we all talk to each other, and if there's problems that you can't solve, then you can refer on to the doctors that we have, and they obviously know a lot of things. So we do have a really good network of people you can talk to. But the courses are invaluable at keeping your skills up to date and advancing them, and then you obviously practice things at work and go on your own intuition and make things up. But yeah, you just really have to keep up to date with things because physio moves so quickly, and if you're not up to date, obviously your athletes aren't going to be getting as good a service as you could provide. And
that's important.
Yeah.
What are the best bits about what you do?
Best bits are when you know that someone's worked and they've overcome problems, and you know that they've trained hard and they've put absolutely 100%, 110% into what they want to do, and they end up getting a really good result at the end of the day, and they're happy and you're happy, and they just get the result that they do deserve to get. And sometimes they just compete even better than they possibly could ever have hoped to have done, and that is better than ever. So
have there been any particular highlights for you?
Yeah, I mean, probably my biggest highlight, career highlight really, and probably it will be, was working with Kelly Holmes, working in the 2 years up to the Athens Olympics. So we managed to keep her injury free for the first time ever for those 2 years, and she went on to win Olympic gold in both the 800 and the 1500 metres, which was an absolutely amazing night. I managed to see both of the golds that she won, and on the night she won the 1500 metre gold, that was shortly followed by the boys team winning the 4x1 relay and winning gold in that as well. And I'd worked with some of the lads in that race, so it was just an amazing night and absolutely fantastic.
Makes all the hard work worthwhile, huh?
It certainly does, and just seeing the joy that they got out of it as well, because particularly in Kelly's case, it was her last chance ever to run in the Olympics, because she would never get the chance again, and to go on and really just do more than she expected.
Brilliant.
It was amazing.
What are the worst bits or the challenging bits about what you do, and how do you sort of cope with those?
The worst bits are if you have to pull somebody out of a race, and again it's that whole thing I've competed myself before, and you know how hard people have worked to get there, and they've tried and they've done everything they could have done, and sometimes it's actually they manage to get into a final but they're too injured to be able to take part in that, and you're having to weigh up whether they could get away with it and go out there and race, or whether they'd end up hurting themselves even worse, and it's actually having to make that decision to pull somebody out. And we have got a very good medical system in that, our doctor in the end, he will make the final call, but it is a really hard decision, because you know that the athlete's going to be heartbroken, and it's a year's worth of work or several years worth of work put into that one thing, and if they can't do it, it's heartbreaking.
Do you work closely with a medical team then when you're treating athletes? Is that how it works?
Yeah, particularly with our sort of UK athletics athletes, there's a really good network there, and obviously when we're on a team, we've got usually 4 or 5 physios and a masseur, and then 2 team doctors, which it's a fantastic team, and we all talk openly about problems, and we've got an ongoing discussion with the doctors about any problems that any of the athletes have got. So no, there's a really good team and fantastic people that are in it professionally.
Now, you've competed yourself at international level and in marathon running. Do you think that experience has helped you to be able to relate to the athletes better that you treat?
Definitely, because it helps you to realise how they feel coming up to a race, that they haven't got pre-race nerves, the way that your personality can change leading up to a race. It helps you understand their fears if they have got a little niggle going into a race, and how that will worry them, and that you do need to be really confident when you're dealing with them, so that they go into race, and that's the last thing that they're worrying about. They can just get on and race. And then obviously just, if you've had injuries yourself, you know how they respond to various treatments and exercises, and it helps in that way. But absolutely invaluable.
So what's been the best lesson you've ever learned?
Just keep looking. You've got to keep up to date. You've got to keep working on something, and then if something doesn't, I think it was my first boss really, she had a policy, whereas if something wasn't getting better in 3 treatments, then you had to start thinking again. And it's that just following something up. Don't treat somebody 25 times. If they're not getting better within 2 or 3, they're not going to get better with what you're doing. You need to think again. There could be something you're missing. You have to keep looking. Ask advice, ask second opinions from other physios, because there will be something you miss. There will be something you've never seen before. And there will be people that don't respond to one particular way of treatment, but they'll definitely respond to something else. So you really have to keep thinking, keep on your toes, think outside the box. And you are looking for ways of getting people better quicker than yesterday. That's what the athletes want. They want to come in and they want to go out feeling like what's wrong. They will get better. They want to go out feeling better, and that there's a plan in action. But no, there's nothing more heartbreaking than having 3 treatments and you still can't see that you're getting better, and is it going to work? But no, just keep up to date and keep trying and keep changing what you're doing. And
because I guess it sounds like it's a lot about problem solving. I mean, someone comes in with a sore shoulder, but you have to work out what's causing it and what's contributing.
Yeah, huge things like that. And again, is someone getting a sore neck because they've got stiff ankles, and it's not, 9 times out of 10 it isn't actually the sore bits that's the problem. There's obviously where the pain is coming from, but you do get people in that get a stiff neck because they've got stiff ankles, and if you're mistreating the ankles, the neck will never get better, and you're never going to get anywhere with somebody. So it's problem solving, and it's looking at the person as a whole, and whether it's psychological issues that they've got, or other health issues that you maybe need to send them off to a doctor or a nutritionist, or it's just making sure that you're looking at the person as a whole and not treating the tiny bit that's symptomatic, actually really figuring out why they're getting injured.
Yeah. So there are aspects that sound very glamorous about what you do, but I guess it's also lots of hard work and long hours. What keeps you inspired and motivated?
I like the challenge. It is hard work, and so there's a lot of figuring out, and just really having to rack your brain sometimes to think about what you're really going to do with somebody. Obviously, it's seeing people get the best out of themselves if you're looking at the international level kind of competition. And then I also see an awful lot of chronic people who, some of them haven't been able to run or function properly for 7 years, 10 years, longer than that, and got real major issues. And it's actually seeing those people and unpicking all their problems and actually getting them from being completely unable to do what they want to do to actually getting them back into, a sporting environment, or even if they're not competing at an international level, they're actually able to function in the way that they want to function. And as I said, some of these people haven't been able to do anything for 7 years, 10 years, longer, and I get a real kick out of that, because you are making a big difference to somebody's life, and I think that is what keeps you going, knowing that you are making a difference to somebody, because that will obviously then have knock-on effects in their own life, whether it's at work, family-wise, relationship-wise. It's good.
Brilliant.